Hello, my name is Pauline Allegari. I'm the Executive Director of the Friends of Mel Foundation, and I'm sitting here with Deb Teevens Gangl, who's a patient navigator with Signature Healthcare in Brockton. And we're really happy to have her here at our third conference, The Art of Living Life Beyond Cancer for cancer survivors and caregivers. Tell us a little bit about your relationship with Friends of Mel.
Well, I first learned of Friends of Mel through the bracelets. I had seen someone wearing a bracelet. Actually, it was a friend of mine who's a Delta flight attendant. And she actually, I asked her about the bracelet, and she told me the story about the Friends of Mel. And then more recently, as a patient navigator, I had the pleasure of attending the conference last year and met Pauline, and I just think it's a wonderful organization, and I'm actually happy to refer a lot of my patients to Friends of Mel.
Thank you so much. Now, this is not the first time you've been to our conference.
It's not. I actually attended last year as a navigator, and I met a lot of wonderful people. I learned a lot about different resources that are available to patients and in the community, and I had such a nice time last year. I decided to come again this year, and actually I brought several of my patients, a couple of tablefuls of patients from Signature Healthcare, and they're really enjoying the conference this year.
Oh, that's wonderful. So you're going to have to help us make it grow even more next year.
I'd be delighted to do that. And I think it's wonderful. I think people are really enjoying themselves. I've heard a lot of wonderful positive comments this year. One woman even asked me if we could have it for 2 days next year.
Oh, we'll have to think about that, but we'll see. We'll see. So tell me, Deb, in your experience at the hospital, what do you see as the greatest need for cancer patients, the greatest unaddressed need for cancer survivors?
Well, I think that we see patients every day, and I think this is typical of any hospital, that when they're finished with their treatment, it's what do we do next? And I think your conference is particularly addressing that need with all the wonderful resources for survivorship. And I think that, especially through our STAR program, which we have at our hospital in Brockton, it was funded by your organization, the Friends of Mel, and it's a wonderful program. It's a rehab program for cancer survivors, and it's been a tremendous help to many of our survivors. And they've gone on and they feel better, they have renewed energy, and they're just really feeling great after going through the program, which thank you to the Friends of Mel for helping to fund that program for us.
And I'm sure in your profession, your relationships with cancer survivors, that you have a clear understanding of the emotional experience they have, the psychosocial piece that isn't always addressed in cancer programs at hospitals. Would you say that the conference meets that need? Because I know that was our goal. So
absolutely, the psychosocial is huge. And sometimes even when patients finish their treatment, they sort of go through their treatment, they have a game plan, and psychosocial, sometimes afterwards when they have time to sort of reflect, it hits them then. So I think that many of the resources here, from Reiki to the cancer wellness community, it's just wonderful. All of these resources that patients, even myself as a navigator, have learned about these resources. So you really provide a terrific service as far as resources, and especially in the psychosocial aspect. So
thank you so much. And I think I want to just say, when I say about psychosocial, we talk about the fear and the anxiety and the depression. What else does that, sadness that accompany this experience?
Absolutely. And a lot of people are paralyzed, don't know how to speak up with their doctor. I mean, all of things like that are exactly what you're saying, and I think it's nice for patients to come here and share their own experience and feel that, if they are fearful, if they have a cough or a cold going forward, it's nice that they all feel that, and a lot of your speakers can address those issues and make patients feel a little bit better going forward. So yes, that's a big part of your conference, and it's a great help to our patients.
Well, thank you, Deb. I'm so glad that you took this time to talk with me, and keep up the good work, because I know that, oh my goodness, there's so many people out there who don't have advocates and they desperately need them. So thank you for what you do. I know that it's not an easy job.
Well, thank you, Pauline, for your support of us, and I appreciate everything that you do for the cancer community. You're just a treasure.
Thank you so much.
Thank you.